Hello everyone, my name is Paula Videniece. I'm very excited and thrilled about this opportunity to be here today with you. Thank you so much for inviting me. It means a lot and it's a great honor to me. I hope that everyone is doing well and everyone is healthy, and hopefully next time we get to meet all in person. Today the topic of my presentation is the enzyme Papain and its application in minimal intervention dentistry. I hope you enjoy it. We have quite a lot of topics to cover today, and we will start by looking into minimal intervention dentistry approach. Then we will talk about chemo-mechanical agents as such, and particularly focusing on caries. Then we will talk about Papain and its application. Then we will look into different products that contain Papain, their clinical relevance and their relevance to cariology as a study. And that will be it. And the sources can be seen on the last pages of this presentation. This presentation has been primarily based on my coursework, and the articles have been obtained in two libraries, the first one being Riga Stradins University Library, and the second library is Bayerische Staatsbibliothek, Munich, Deutschland, Germany, and that is where I live at the moment. And there were a lot of articles that came up, and I selected altogether 57 sources, which are listed in the last 4 slides. Minimal dentistry approach includes prevention, and that focuses on the education of the patients so that they can execute good self-care, and regular visits are important so that the doctor can monitor any kind of small incipient caries. Communication has been mentioned as the key element in minimal intervention dentistry because it allows patients to trust and make these regular visits. And so early diagnosis is also very important because we can remineralize a lot of initial caries. However, when the caries has gone beyond the point of enamel and has started to go into the dentin, and this cavity has become very hard to clean for the patient and they can't reach it themselves anymore, then restorative treatment is indicated, and the least invasive, who knows which one it is because there are not a lot of studies in comparing them all. However, all of them have been reported to be better than conventional rotary method in many occasions. We will look into chemical-mechanical caries removal agents more in detail in the next slides. We can divide chemical-mechanical caries removal agents largely in 2 groups, the first one being enzymatic, which contains plant-based preparates, and we have also biofossil, which is also enzymatic but is still in experimental stage and is not available. Then the second group is sodium hypochlorite containing products, which is caries at the moment that is available on market. Goldman was first to develop chemo-mechanical caries removal method, and he achieved this by using sodium hypochlorite at a concentration at 5%. So this proved to be toxic and aggressive to healthy and sound tissue, so he had to do something about it. He changed the composition and he developed GK1019. So that was then further developed, and further discoveries revealed that aminobutyric acid was more component than glycine, which resulted in development of GK101. The next invention was Caridex, and this was introduced in US during the 1970s. On market it became available during the 1980s. This system was supplied in 2 separate bottles, and these solutions had to be mixed together promptly so that the working reagent reaches pH 11. This altogether was stable only for 1 hour, so it has to be used within 1 hour. And what Caridex did, it induced chlorination and disruption of the partially degraded collagen fibers in caries dentin alone. Although there were similar benefits as those of today's chemo-mechanical caries removal agents, this product just didn't get popular because it was expensive and bulky and impractical in clinical setting. But the idea was continued and developed by Medi team in Sweden, who launched CarieSolve in 1998. So, the fundamental dissimilarity between CarieSolve and Caridex was the use of 3 amino acids, lysine, leucine, and glutamic acid instead of aminobutyric acid. I would like to talk a little bit more about CarieSolve in detail because it's regarded as golden standard in the world of chemo-mechanical caries removal agents, and it is often compared to other agents, also those containing papain. Therefore, I thought it would be interesting to look on the action mechanism of this product. So it is based on proteolysis induced by sodium hypochlorite, which dissolves the infected dentin. Additional action of amino acids enhance the effect of sodium hypochlorite on denatured collagen and minimizes the damage to healthy tissue, enabling the removal of infected dentin and preservation of affected dentin. Therefore, it is in line with minimal intervention dentistry philosophy. So basically, it is selective in its nature, and it is also said to be safe for the tissue by, as I said, numerous studies. And I would like to point out particularly study made by Hama and her colleagues in 2014. This image is taken from that study in the corner of the slide. So they conclude and they write about the effects of the direct application of CarieSolve gel on exposed pulpable tissue. Mostly they used rat models, and they reported that CarieSolve gel had no adverse effect on the dental pulp. And interestingly, CarieSolve had a similar action as calcium hypochlorite pulp capping materials. CarieSolve has bactericidal and hemostatic effect on exposed pulp tissue, which is attributed to the alkaline pH of 11. Histological findings showed CarieSolve used minimal superficial necrosis. That was what it caused at the pulp exposure sites, and this effect could promote the repair function of the injured pulp. That's what they say. Finally, we get to papain enzyme. So this enzyme is collected from a green papaya fruit, which are cut in their surface. And as you see in the image, the latex then accumulates on the surface of the fruit, where it can be allowed to dry, or it can be collected in small containers and then dried further. Then there is a purification step which is necessary to remove contaminating substances from this dried crude material, and this purification process involves solubilization and extraction of the active papain enzyme. The purified product can be supplied as a liquid or as a powder. Many industries benefit from papain, and so do we. If anyone is interested in more detail of traditional medical uses of carica papaya, there is this article in the Journal of Medical Plant Studies, and it is readily available on internet. I chose these two tables because they illustrate the scope of all the goodness that is in this plant altogether, including all parts of the plant. And there are a lot of good tips for health and well-being in this article. If you're interested, please find it. It was quite amazing. It is important not to lose one's critical thinking in the face of overwhelming information in the internet regarding plant-based medical products and also health supplements. And I thought that it would be interesting to see what Healthline and MedSpace says, and amongst the quite promising benefits of the health, they also point out the possible risks, and it is only possibly safe when taken by mouth in medicinal amount and when applied to the skin as a solution in appropriate amounts. So possibly safe, possibly unsafe when the doses are exceeded, and some people can have serious stomach and esophagus traumas. Applying raw papaya or papaya fruit alone to the skin is possibly unsafe because of the allergic reaction that papain can trigger. However, I would like to say that in the dental studies, none of the articles said that papain would be causing any kind of allergic reaction. In the contrary, they said that there was nothing like that. Mechanism of action has not been fully understood yet, but what we know is that papain is a cysteine protease and it degrades proteins by catalytic triad mechanism. In healthy tissue we have alpha-1 antitrypsin, which inhibits the proteolytic activity of papain enzyme. So this is important in clinical relevance because that makes papain containing products self-limiting. So when they meet this alpha-1 antitrypsin, they just become inactive. That's the idea. And on the right side we can see there is a diagram which represents the mechanism of action for papacari, and at the end point we see that we obtain this softened dentin, which is possible to be removed with curate. This image has been taken from Natural Oral Care in Dental Therapy. It's a book which has come out this year. And here we can see the overview of the potential applications of proteolytic enzymes in the field of dentistry and oral care. And I would like to straight away mention that we are not talking here just about papain. We are also talking about bromelain, which is an enzyme derived from pineapple, and actidin, which is an enzyme found in kiwi fruit. So we can see how many different fields of dental medicine can benefit from these proteolytic enzymes. However, we will be focusing on chemo-mechanical caries removal and products containing papain enzyme. First and foremost, I would like to introduce you to papacari gel, which contains papain, and this is the first kind of product like that, and it was developed by Professor Sandro Calli Bussatori in Brazil in 2003. It has been manufactured since 2004. It has been extensively studied. Most of the studies that I have are actually conducted on papacari or having papacari as a reference for other papain-containing chemo-mechanical caries removal agents. And these studies conclude that papain has antibacterial activity and that it inhibits the growth of gram-positive and gram-negative organisms. Gel also contains chloramines, which are formed by reaction between chlorine and ammonia. These have bactericidal and disinfectant properties. Tulamine blue is also present in this solution, and it is photosensitive pigment that fixates onto the bacterial membrane and has been found to be highly effective against Streptococcus mutans. The product degrades and eliminates the fibrin mantle formed by caries process, breaks the partially degraded collagen molecules. The degraded collagen is then chlorinated by chloramines, resulting in chemically softened caries dentin, which can be easily removed with blunt hand instrument. This procedure should be repeated until the gel remains clear. So papacari combines atraumatic, conservative and selective properties for the removal of caries dentin. The antibacterial properties that reduce the number of cariogenic bacteria and absence of dental mud on the surface of prepared cavity improves the bonding of the restorative material. Reduced risk of pulp exposure and preservation of healthy tissue makes it an excellent option for caries removal overall. Carie Care is another relatively new product in the market. It has papain as its active ingredient, and additionally there is a clove oil in the content. Therefore it has analgesic and anti-inflammatory effects. In various studies, different protocols are used for the application of Carie Care. However, the results have been relatively comparable to those of papacari, even though in some of the studies it was left in cavity only for 30 seconds and removed with blunt instrument, whilst in other studies it was suggested that it should be removed with a cutting instrument. You might wonder about the presence of clove oil and the bonding capabilities of Carie Care prepared in affected cavities, and Shruti Nair and his colleagues in 2018 conducted a study, it was a systemic review, that concluded that none of the adhesive systems were influenced by this product. Therefore, it is safe to use in restorative procedures. Another interesting study examined how carie care and Papain affect Agrigabacter actinomycetem comitans, which is a major periodontal disease pathogen. And in this study, it was demonstrated that carie care has a better antimicrobial action. This was an in vitro study where different Petri trays were examined, and they concluded that there is a dose-related effect. The last thing I would like to mention about carie care is that it is said to be more economic than Papain, for example. Brix 3000 has been developed in Argentina 2010, and they are using encapsulating buffer emulsion technique, which is different from the other products. They're claiming that this gives the product extreme stability and increases the enzymatic activity. They're saying that the higher proteolysis effectiveness is achieved, therefore, and there is less dissolution of active principle by oral fluids. You can see how favorable the conditions for storage are in the small box in the center of the slide. The application and the working protocol is similar to that of other chemical-mechanical caries removal agents, and you can remove the caries with blunt instrument. I've tried it myself too. It's quite easy to work with. The gel is rather stiff in comparison to carousel, for example. And what is interesting is that their gel does not contain chloramines in its formula, which enhances its toxicological safety feature. So basically they're claiming that Brix has no adverse health effects and it is as safe as it gets. While their sales team has done an excellent job on Brix 3000 products advertisement and informing of both health specialists and patients, there are not that many official studies made in comparison to Papain, for example, and often they are benefiting from those studies done on other Papain containing products. So I just wanted to bring that up, that there has been very little contributing from Brix, studies done on Brix, to the whole presentation. However, I wouldn't want to discredit the product because I enjoyed using it myself and it was beneficial in my personal experience, and recommend it to anyone who was interested to start with something like that, just due to the fact that you can keep it in drawer without worrying about special storage. Amongst many studies on Papain containing products, also Apocari's gel pops up. This has been developed in Thailand, and what is interesting about it that they are including mangosteen extract in combination of Papain in the composition of this gel. However, I didn't find that much information on this product. There was only mentioned a few studies, and I took my most information from a study done by Coley and colleagues in 2015. Tried to contact the professor which was involved in this study, but without success, and I must say that I also couldn't find the product on internet for sale. Wouldn't know what would be the reason for that. Based on the literature, we can safely conclude that caries removal is selective and effective. Here I have included two tables. On the first one you can see the reference, and on the second table, table B, you can see how much of caries dentin was removed and how much of affected dentin was removed. And it has been stated that mineral density values in residual dentin were always higher or similar to the threshold for mineral density values in caries dentin. The Papain-based gel proved to be effective in removing caries dentin up to conservative in vitro thresholds. Up until now, most of the dentistry professionals have been using a traditional historical approach where the treatment of dental disease has been managed with complete excision of the diseased tissues, which means that the affected tissue was also seen as gangrenous almost, and clinicians for most past century have used Black's cavity designs and the principle of excision for prevention. This is a purely surgical approach, and with increased understanding of the composition of dentin and possibilities to repair it by mineralization, We are slowly moving away from this quite invasive approach, and it is a psychologically difficult step to make for many people because the cavity does not look clean and shiny, and we shouldn't finish our preparation in completely healthy dentin. It's just not necessary. The important part is that the margins are clean and are on the healthy tissue to prevent leakage. However, the cavity itself can be stained, and that we should train ourselves to see that as a normal process. To my mind, this image speaks volumes and was one of the most inspiring images that I found during my research, because here we can see how thin the residual dentin wall is between the cavity and the pulp chamber, and you can imagine how easy it would have been to perforate it with conventional rotary method. And in this study, they just said that the overall removed dentin volume was similar or higher than the initial caries volume, indicating that the method was able to effectively remove dentin tissue. Samples with an almost perfect accuracy in caries dentin removal also showed an increased removal of caries affected tissue. On the contrary, less or no affected dentin was removed in samples where some caries tissue was left in the residual dentin. Another way to assess the selectivity is microhardness tests, which were performed in vitro in different studies, and they concluded that the softer dentin closer to the cavity floor was allowed to remain, which means that it is a selective and non-invasive treatment option for dental caries removal. In this image, I would like to draw your attention to scanning electron microscope dentinal substrate after the use of conventional rotary method. We can see how smooth the surface is and these parallel grooves. I would also like to draw your attention to smear layer, and it is known to be present along the cavity walls after rotary instrumentation consisting of particles ranging in size from less than 0.5 to 1.5 micrometers. And it should be removed because it is unpredictable in thickness and volume. The presence of bacteria along with their byproducts and necrotic tissue has a potency to act as a substrate for other bacteria. It may limit the penetration of disinfectant agents, may act as a barrier, and compromise formation of satisfactory marginal seal. As a loosely adherent structure, it might act as a potential avenue for microleakage and consequent bacterial contaminant passage between the filling and the cavity wall. So that's why it is important either to remove it by etching or integrate it in all-in-one system. Here in contrast you can see the dentinal substrate which has been obtained after chemo-mechanical caries removal agents containing papain, and a similar pattern is seen after the use of Carisolve 2. And I would just like to draw your attention onto open dentinal tubules and exposed collagen network, as well as the globular appearance, and I would like to invite you to think about what could be the consequences for bonding and forming resin tags on this surface in comparison to that of the conventional rotary method. In this image we can see hybrid layer obtained after conventional rotary method, and though it is adequately thick, the one produced by chemo-mechanical caries removal agents is thicker with lateral branching, and we will see that in the next slide. In this image you can see the network-like structure that has been penetrated with monomers, creating strong lateral branching in many places, long resin tags, and also the dynamics of the line between the filling material and the dentinal substrate. It's very dynamic. When we think about restorations that we have placed after our treatment and the kind of guarantees we can give to patients, we're thinking about microtensile and bond strength values. Marginal leakage also plays an incredible role subsequently. And here I found two studies very interesting. Sturinair had concluded that the different chemo-mechanical caries removal agents didn't compromise negatively the bond strength in comparison to the control group, which was performed with burrs, the conventional rotary method. And interestingly, their bond strength values were generally lower than those found in other studies, and they explain it by the cavity preparation depth, because when you prepare the cavity up until, for example, dentino-enamel junction, then there is only 1% of moisture, of water in the content of the dentin. However, if you go towards the pulpal cavity floor, deeper and deeper, then there is 22% intrinsic moisture, and that could compromise the bond strength. They used M3 materials as bonding agent. They used M3 single bond, which is very popular, at least here in Europe. And the other study by Mauro and colleagues in 2014 examined Papain treated teeth and found that there was 47% marginal leakage in comparison to the teeth treated by conventional rotary method, where they found 86% marginal leakage cases. And also the bond strength was found to be greater in Papain group, where they had 12.9% megapascals, and conventionally rotary method had 9.64 megapascals, and therefore you can say that that the Papain group showed generally better results. It is known that the main etiological factor for caries development is the ecological shift within the dental biofilm, basically going from friendly bacteria, which is balanced and beneficial to extent to us, to an acidogenic, acidoduric, and cariogenic micro community in the biofilm, in the plaque. And this then is maintained and developed by the regular exposure to fermentable dietary carbohydrates. And today it is said that eliminating all the microorganisms is not mandatory for ceasing the carious process, but what matters more is to isolate them from the fermentable carbohydrates, so nothing feeds them, so they don't grow. The group of bacteria that primarily causes dental caries is mutant Streptococci, which consists of 7 species and is strongly associated with dental caries. When considering the process of residual microorganisms in prepared cavity, I personally think that it would be nice to minimize them as much as possible, and that chemo-mechanical caries removal agents do that is a highly desirable property of them. And we know that here we have this study, which I found extremely inspiring, where they are looking into the patency of the intertubular bacteria, and we can see that Papain and chlorhexidine has around the same bactericidal properties. And I just would like to say that here actually it was applied to the dentinal substrate, which was artificially infected, and then it was applied for 5 minutes. So that's something to keep in mind, of course. According to the studies, we can safely conclude that papain containing products really do have these desirable antibacterial properties. However, for example, here I found a study by Al-Humaid and colleagues in 2018 where they showed that the conservative approach of the dental removal could result in some cases in still smear layer present in the cavity walls and some of the dentinal tubules closed with the residual bacteria, and they do point out that it is contradictory to some other studies done on the same topic, and that there isn't like 100% consensus on how much or how little smear layer is left there, whilst most of the studies do say that there is almost none at all. And Giovanti and colleagues examined mangosteen extract in combination with papain, and they found that only 1 milligram of mangosteen extract with papain in apocaries gel effectively inhibited Streptococcus mutans within 2 minutes, which is absolutely fantastic. The dentinal carious lesion can be divided into 2 zones: an outer layer of infected dentin in which the collagen fibers are partially degraded already and cannot be remineralized. They're already structurally lost parts, And then there is the inner dentin layer, where the collagen fibers are partially demineralized, so structurally they are the same, just lost minerals, and can be remineralized. And the chemo-mechanical caries removal systems aim to cause this further degradation of already partially degraded collagen fibers, while actually sparing the demineralized portion, therefore being minimally invasive altogether. And what is alarming is, for example, a study from 2010 by Bertsoni and colleagues, which said that these intact collagen fibers do get affected negatively by Papain gel after only 30 seconds of application. They saw signs of degradation, however, not really ruptured collagen fibers, which is still reassuring. However, we need to think about the other aspect of their study, where they examined dental small pieces that they had prepared in vitro, and after application of dentin to this dentin of papacaries gel, they saw a significant twofold drop from normal dentin values, and that is alarming. However, other studies have found opposite, and they are also in vitro. And Java and colleagues in 2010 contradicted this study by saying that evaluating dentinal tubule structure in samples which were stained with homotoxylin and eosin, it was observed that the dentinal tubules were not destroyed. In the specimens prepared by Papacari, however, implementing conventional rotary method, the opposite could be seen. So, I would like to point out that in vitro studies can't take in consideration the presence of alpha-1 antitrypsin, which is found in healthy tissues. Therefore, more studies like this should be conducted to really understand how it affects healthy living tissue. Regarding effect on teeth, here we come to soft tissue, which could be the most important even. And I would like to say that the first study used fibroblasts derived from the actual dental pulp of the third molar germ, and they used immunolabeling with antibodies and immunofluorescence imaging to analyze these cell cultures for the presence of vimentin, type 1 and type 3 collagen, fibronectin and osteonectin. In all study groups, vimentin demonstrated a very strong labeling with a reticular network-like appearance in cytoplasm. Fibronectin also exhibited intense immunostaining with similar distribution pattern in all groups. Osteonectin was more expressed throughout the cytoplasm of the pulp fibroblasts in group 2 and 3. These groups are Papacari and Karasov group, and have weakly positive immunolabeling in the control group. Type 1 collagen appeared a little bit stronger in the control group. Bastos and colleagues in 2019 concluded that papain-based gel presented a concentration-dependent cytotoxicity without affecting cell viability. They basically looked on cell macrophages and dental pulp cells, and they concluded that 5% Papacari duo solution was cytotoxic to macrophages. However, at 0.5% concentration, no cytotoxicity was observed when compared to a positive and negative controls. Interestingly, the gel presented an inhibitory effect on pulp cell differentiation, but modulated the activation of macrophages stimulated by lipopolysaccharide. The authors speculate of this study that in the dental pulp tissue, Papacari duo would impair reparative dentinogenesis, but could activate macrophages to perform their role in defense and inflammation. In the discussion part, they also talked about the fact that actually product very rarely comes in contact to pulp cells at that concentration, and that it only should be considered where there would be very, very, very thin margin between the pulp and the cavity floor. The ease of use is characteristic to chemo-mechanical caries removal agents, because it really just consists of putting in gel, letting it there stay for a while, and scratching it out. So it is also said to be cheap, and there was a study done by Bogetta and colleagues in 2018 which examined exact prices of Papain applications and had managed to do the procedure with lower costs for the Papain procedure of 91 cents when comparing to conventional rotary method where burrs are used, that of $1.58, and enabling a cost reduction of 42%. That's quite a lot. When local anesthesia was used in the conventional group, $2.17 were the total cost, and then the cost reduction when compared to this group is that of 58% when using Papain. Combining drill and Papain in the same procedure amounts to $1.37, and that gives us 33% of cost reduction. I made this table to give you a better overview of the different studies regarding the time taken for each procedure, and we can see that their tendency is that chemo-mechanical caries removal procedures take generally more time. However, when we look on different aspects of the studies which examine the patient's response, it is generally thought that chemo-mechanical caries removal procedures are more pleasant for the patients. Even though some of these are subjective ways of looking on patients' pain scores, either by operator or by themselves, we also have a pulse meter studies which indicate lower pulse rate for the groups treated with Papain, for example. And I think it is significant to the communication with your especially small patients or patients that have had previous traumas. And this is one of the most praised aspects of these systems, that they are patient psyche friendly. There have been identified different unpleasant elements in dental treatment. So, for example, vibration of dental turbine, the anxiety associated with local anesthesia, sound from both the turbine and the suction devices. These all contribute to increased stress levels for the patient. And these are elements, for example, are absent in chemo-mechanical caries removal procedures. And if the patient has had already negative experience and traumas, then perhaps they would be even more benefiting from these type of procedures in comparison to conventional procedures. And here we can see different pain perception and comfort level, and that could also be explained by the fact that with selective dental removal we don't invade so much the sensitive parts of the tissues where the nervous tissues are still present and alive. The complexity of psychological processes in young patients make it the subjective evaluation where children have to answer questions not entirely reliable, and therefore it is lovely that we have these studies which have more objective ways of measuring anxiety, such as heart rate and pulse measurements. So there we can see that again that Papain group has less stress when compared to the drill group, especially during and after the treatment. And this table brings us also to the next topic, which is examining restorations on the recall visits. Regards to recall studies, there aren't that many. The longest time frame I could find was performed by Motta and colleagues in 2014, a study that preferred Papain over conventional rotary method at the time frame of 18 months. And there should be more of these type of studies so we can find out what happens to these restorations also after 2 years, which would be clinically relevant. Regards to the aesthetics of resulting treatment after caries removal, in this case performed by Papain, we can see satisfactory results. And in this study they argue that also for children it is important to have aesthetic dentition because it aids their social development and improves their confidence levels. These two tables present the results of glass ionomer cement restoration examination at different time intervals. In the first table we see no statistical difference between the two study groups, the conventional and Papain group, and in the study underneath we can see that which I referred to a little bit earlier, that after 18 months of restoration being there, the Papain group showed generally better results. Here is the results from a study with a larger sample group, where we can see that the most of the restorations are really present with no need for repair after 12 months. And only one radiological evolution with pulp involvement present was found amongst these restorations. Such results are highly inspiring for people who want to use these type of products in their daily practice. Finally, I would like to talk about tooth whitening toothpastes that contain enzymes, and both of the studies used a paste that contains papain and bromelain, the pineapple enzyme. And so that the first study examined photos and luminosity and found statistically significant difference. And the second study used Vita Shade Guide, and you can see for yourself on the bottom of the right side of the screen there is a table where you can see the jump in the shades and the significant differences. And the reason why these toothpastes could work is because they speculate that some parts of the pellicle could be degraded by these enzymes, which then would release the pigments, because pellicle is responsible in the first place for integrating the pigments and therefore creating these stains. We have come to the end of the presentation, and I would like to read out some of the conclusions. Chemo-Mechanical Caries removal agents containing papain are causing less stress for patients in clinical setting. They are selective and effective. They have antibacterial and antiseptic properties. They produce little or no smear layer, leave patent dental tubules and irregular surface. They are not toxic to pulp fibroblasts, however, can be toxic to other cells depending on concentration of the gel. They are promoting a thick, well-formed hybrid layer. They are supporting successful restorations. Unfortunately, they are taking significantly more time. However, examining dentifrices containing papain, we can conclude that they have a capacity of tooth whitening. Thank you so much for the attention and the opportunity to talk about these topics today. I'm happy to introduce you to chemo-mechanical caries removal agents, because I think that they really have a significant place in the future for our profession, and I hope that you can take something home from my presentation, that you have learned something. If you want to find out more about this topic, you are welcome to email me. I would like to share any information that you would be interested in, or help you to select some of the articles that sounded interesting to you. Just let me know, and all the very best to you, and much love. Keep healthy. Bye.